What's up guys, I'm Nurse Blake and welcome to my channel. In this video, I'm going to help you find your perfect nursing job. Whether you're right out of school and looking for your first nursing job or you want something new, I'm going to help walk you through the questions you need to ask yourself to find the perfect fit. I believe a happy nurse is a happy patient. So you have to have a job that you like and that you love and one that you're excited to go to work at each and every day. All right, so first thing you need to ask yourself, adults or pediatrics? This is one of the most important questions that you have to ask yourself. Do you want to help care for the adult population and their families, or do you want to help care for the pediatric population and their families? Do you want to clean up big poop, or do you want to clean up little poop? Do you want to clean up big code browns, or do you want to clean up small code browns? I don't know, I don't want to clean up any code browns, but I need a job and I'm a nurse. So you have to decide which one's going to be a perfect fit for you. There are some hospitals that only cater to the adult population, and there's some hospitals that only cater to the pediatric population. However, some hospitals do both, so this will really help narrow down your search. Second question, do you want to be in trauma or non-trauma? Trauma hospitals cater to those with obviously traumatic injuries, so injuries from falls, motor vehicle crashes, gunshot wounds. And then you have non-trauma hospitals, which sometimes have their own specialty. So do you want to be in trauma or non-trauma? Trauma hospitals are extremely busy, and you honestly don't know what you're going to get rolling through the doors, or rolling into the ER, or rolling up to your floor. And you really have to love trauma and caring for these patients, because traumatic injuries come out of nowhere, and really they could happen to anybody. So it takes a special kind of nurse and a special kind of healthcare provider to help traumatic patients recover. And if trauma is not your thing, that's okay. There are plenty of non-trauma hospitals in your area. Do you want to work at a big hospital or a small hospital? Do you want more drama in your life or even more drama in your life? Actually, I don't know if a big hospital or a little hospital, they probably honestly have the same amount of drama. And wherever you go, there's gonna be a little drama. But who doesn't love a little drama? Big hospitals. Typically, these are more in your downtowns or in the big cities. Then you have your smaller hospitals, which are more in the suburbs or your more rural areas. Small hospitals could have anywhere from 50 to maybe 200 beds. And then you have your large hospitals, which can have 400 to 700 and more beds. And it's really just a different feel and a different culture. Typically at smaller hospitals, everyone knows each other. All the staff work together on a consistent basis. You know everyone who's walking down the hallways. And your big hospital, you're working with a variety of different people because there's tons of employees, because there's so many beds and so many patients to care for. So you may not know everyone that you see in the hallway, and that's okay. It's just a preference. Do you want to work in a big hospital or a baby hospital? Do you want to work in a big hospital or a small hospital? Drama? I don't even know. I don't know. I feel like the bigger hospital will have more drama. But if everyone knows each other in the smaller hospital, there may be more drama because everybody knows your business. And personally, I don't like everyone knowing my business. However, you can follow me on Instagram and learn a little more about my business. Question number 4. Do you want to work at a teaching hospital or a non-teaching hospital? And if you're right out of nursing school, your teaching hospitals are the ones you did clinicals at. So they're used to having nursing students and medical students on the floors on a daily basis. So the staff are used to teaching and they're used to having students around. Some hospitals are non-teaching, so they don't open their doors to students. But that's okay. They're still gonna teach you, and you're still gonna go through probably a pretty good orientation, but again, it really comes down to culture. I believe hospitals that are teaching hospitals, they are more familiar with students, how to handle students. You could ask questions more freely, and then non-teaching hospitals, they're probably not gonna have that same feel as a teaching hospital. But that's okay. These hospitals are still gonna teach you, they're still gonna orient you, but it's really just a question to ask yourself and something to keep in mind when you choose your next job. Item number 5, you need to choose your unit or specialty, because this is going to be a unit and floor that you walk into every shift. And it's got to be a patient population that you like to care for. So if you're interested in the neuro ICU, make sure that hospital has a neuro ICU. Or if you're interested in oncology, make sure the hospital you're interested in has oncology. Item number 6, travel time. How long you like being in your car? If you like being in your car a long time, then find a hospital that's far away from you. I kind of like that because I like listening to music, so I don't mind a drive. Or if you don't want to drive in your car forever, every morning and at the end of every shift, look for a hospital that's close by. Commute time plays a huge role in how happy you're going to be driving to work every day. Because if you're stuck in traffic every day for an hour and you don't like traffic and you're miserable, you're probably not going to arrive at work happy. And if you're leaving work after a long 12 or 13 hour shift and you're in traffic every day, it's going to turn your workday into 15 hours. And for some people, that's not enjoyable. So look for a hospital that's closer or nearby, so you cut down your commute time, so you're not wasting so much time in traffic and on the road. And really, driving is dangerous. I would prefer people to work nearby so they don't get any types of crashes. I used to work in trauma and injury prevention, so that's my injury prevention coming out. Item number 7, pay. It's really important to know the market that you're applying for and what the average pay is. So utilize things like glassdoor.com, and you'll really be able to narrow down the average salary or the average hourly. That's a new word. I was thinking salary and hourly. I said what?
You said hourly.
Oh geez, hourly. Sometimes I come up with new words, so make sure you're applying for your hourly rate. So utilize websites like glassdoor.com. You'll be able to find an average salary range and even an average hourly range for nurses in the area or the market that you're applying for. Last thing, item number 8, and this is really for the new grads. So if you're looking for your very first nursing job, and that is a nurse residency program. Make sure that the hospital and unit you're applying for has a nurse residency program. And what that is, that's a transition program from being a nursing student to now a licensed practicing nurse. And nurse residency programs help guide the new grads and help you transition into the workforce. So they're going to make sure that you cover important knowledge areas as you're entering your first nursing job. Going into nursing and having your first nursing job can be very, very stressful. So it's important to have people that are in your same shoes, going through the same struggles and accomplishments that you're gonna face within your first year of nursing. So it's really important, and it's something I highly recommend that you apply to a hospital that has a nurse residency program. So in closing, I want you to find the perfect nursing job for you, and one that's gonna fulfill you, and one that you're gonna be excited to go to every day. Nursing's not gonna always be easy, and you're gonna have struggles and you're gonna face challenges. But it's important to use those challenges to help make you a better nurse. And it's okay to challenge yourself. And in nursing, you're gonna have days that are better than some days, and you're gonna have days that are worse than other days. Does that make sense? I don't know if that made sense. So take your time in searching for your perfect nursing job. And it's okay, it's good. The process is gonna be long. It can take anywhere between 1 month to up to 3 months to get a job. And that's from the application process all the way up to you starting orientation. So actually spend time and find a job that's gonna be a perfect fit for you, because I want you to be happy. And I'm sure patients want you to be happy too. So I hope these tips really help you, and I hope they guide you and can help you find a perfect nursing job for you, because I think finding a perfect job is important. I want to know how your job search is going, so make sure you leave comments down below and I'll follow up with you. And if you have any additional questions, make sure you comment and I'll answer back. Thank you so much for watching. I'm Nurse Blake. You can also find me on Facebook and Instagram, and have a great shift. Oh, you guys don't have jobs yet, but that's okay. I typically always say have a great shift. So I will just leave you with have a good day. And once you find your job, have a great shift.